You are watching this video because you or your sleep partner or spouse has snoring problem. Snoring is mostly annoying for your bed partner and often disturbing their sleep. What causes snoring, and what can you do to stop it? When you breathe, air passes through your nose, mouth, and throat. Snoring occurs when air cannot flow freely through the narrowed or restricted airway, as you breathe during sleep, causing the tissues of the upper airway to vibrate. The airway, including the soft palate, which is the back of the roof of the mouth, tonsils, and tongue, vibrate against each other as you force air through. The vibrations make a rumbling, rattling noise that is loud snoring noise. Estimated 45% of adults snore occasionally and 25% snore regularly. Snoring is more common in men over 50 who have overweight or obesity. Men have narrower air passages than women and are more likely to snore. Postmenopausal and pregnant women also snore. Snoring can be caused by a number of factors: your sleeping position, body weight, your lifestyle, age, gender, health conditions, head and neck anatomy. Snoring is most frequent and loudest when sleeping on the back because gravity pulls the tissue in your airway downward, which narrows the airway. So, change your sleeping position. Sleep on your side. This is the best sleeping position to help reduce snoring because it helps keep your airways open. People who are overweight may have extra tissues in the neck, back of their throats that may cause narrow airways. Even though someone is not overweight in general, having excess weight just around the neck or throat can obstruct airway and make it harder for air to pass through while sleeping. Belly fat can also press against your diaphragm, causing disruptions to breathing. Losing weight will reduce the pressure on your throat and nasal passages that can significantly reduce snoring. A study found that losing any extra weight can not only reduce your snoring, but it may also eliminate it completely. Consuming too much alcohol before bedtime can cause snoring. Alcohol relaxes throat muscles and causes them to obstruct your airway and make breathing more difficult. Be sure to stop consuming alcohol at least 3 hours before bed. This gives you plenty of time to leave your system and your breathing will be better while you sleep. Avoid eating heavy meal before bedtime. Full stomach and belly can exert pressure on your chest and negatively affect your breathing. When your stomach is very full, your diaphragm has less room to expand and contract. This causes shortness of breath, and strained breathing can cause snoring. Eating large meals or consuming certain foods such as dairy or soy milk right before bedtime can make snoring worse. Try not to eat heavy meal just before bedtime. Smoking is one factor causing snoring. Nicotine and cigarette smoke can irritate your airways and cause inflammation, which may lead to narrow airway. While quit smoking is easier said than done, it can bring quick snoring relief. As you get older, your throat becomes narrower and the muscle tone in your throat decreases. Loss of muscle tone in your tongue and throat can cause airway obstruction and breathing problems while you sleep. Airway narrowing is a common cause of snoring in older adults. Myofunctional therapy helps stop snoring through specialized exercises for your nose and throat. Myofunctional therapy can help rebuild the muscle tone in your mouth and throat, preventing these muscles from obstructing your airways. Studies found that myofunctional therapy reduced snoring intensity and frequency. Allergies and infections like the common cold are the most common causes of nasal congestion, can cause narrow airway and make snoring noise. Cold and allergy medications relieve nasal congestion and help you breathe freely. Try sleeping with a humidifier. Humidifiers are machines that increase the amount of moisture in the air for a more balanced indoor environment. A humidifier is beneficial when your snoring is caused by congestion or dryness in the air. Snoring can be the result of a physical feature, such as the anatomy of your mouth. The size, shape, and position of your jaw, tongue, throat, and neck can also contribute to snoring. Some people may have a long soft palate or large tonsils, enlarged tongue, small jaw, excess soft tissue in the throat which can narrow the airway and cause snoring. If you have a structural defect in your airway, such as nasal polyps, non-cancerous growths in the nose, or a deviated septum, your risk of snoring is greater. Women snore during pregnancy because of changes in hormone levels and weight gain. Hormone level changes dilate blood vessels and cause mucous membranes to swell in your nose. Nasal congestion and a narrowing of nasal passages cause snoring during pregnancy. Snoring is often associated with a sleep disorder called obstructive sleep apnea, also known as OSA. OSA is a sleep disorder where you experience pauses or stops in your breathing during the night. When you have OSA, snoring is caused by your airway becoming obstructed. Periods of loud snoring are mixed with brief periods of silence when your breathing stops. After a few moments, you may gasp, cough, choke, or snort as you begin to breathe again. Brief interruptions in breathing may happen up to 20 to 30 times every hour throughout their sleep. As a result, oxygen levels in the blood fall and the brain jolts you out of deep sleep so that you take a breath. Obstructive sleep apnea often goes undiagnosed because many people don't realize that they have it. Snoring is accompanied by any of these symptoms, you should see a doctor. For snoring caused by OSA, following options your doctor might suggest: custom-fitted dental devices. Form-fitting dental mouthpieces that help advance the position of your jaw, tongue, and soft palate to keep your air passage open. Your dental specialist will make to optimize the fit and position of the appliance. You'll also work with your sleep specialist to make sure the oral appliance is working as intended. It will be necessary to visit to the dental office at least once every 6 months during the first year, and then at least annually after that, to check fitting and assess your oral health. Side effects from wearing these devices may be excessive salivation, dry mouth, jaw pain, and facial discomfort. You can also use continuous positive airway pressure, CPAP. This involves wearing a mask over your nose or mouth while you sleep. The mask directs pressurized air from a small bedside pump to your airway to keep it open during sleep. CPAP is the most reliable and effective method often used to treat snoring when associated with OSA. Some people find it uncomfortable or have trouble adjusting to the noise or feel of the machine. There are so many anti-snoring devices available on the market. Unfortunately, many of these devices are not backed up by research. Not every device is right for every person. Trying to stop your snoring may require patience, lifestyle changes, and a willingness to experiment with different solutions.